everybody, welcome to the session this week. I hope you're all well. I will be covering preceptorship for nurses and nursing associates this week, and this is part of a nurse education series. All my videos are free on my YouTube channel, Support and Career Development for Nurses, so lots of resources for clinical educators, nurse educators and managers, as well as new starter nurses and nursing associates. So today I will be giving you a simple overview of the key terms and preceptorship framework, some templates and resources that will be helpful for employers and preceptors and people delivering preceptorship, and also practical tips to support newly registered nurses and nursing associates. And this links really nicely to a session I did a few weeks ago that gave an overview of support available for newly registered nurses and nursing associates. So I really hope you find it helpful, and if you enjoy the talk, give me a thumbs up on YouTube and do subscribe to my channel for future notifications. So what is the purpose of preceptorship? I do a lot of talks to third year students and newly registered nurses, and they do get confused by the term and want to know in simple terms what it is. So the purpose of preceptorship is to provide support, guidance and development for all newly registered practitioners. So it's not just for nurses, it's for physios, OTs, any healthcare practitioner, to build confidence and competence as they transition from student to autonomous professional. So I really think that's really succinct and covers everything there. And this reference came from National Preceptorship Framework for Nursing, and the reference is for NHS England 2022, and I have the reference at the end of this talk. And the authors were Dr. Jane Ray and Desiree Cox, and they've completed an amazing piece of work this year, collaborating with organisations and professional working groups to learn and share from best practice to develop this preceptorship framework. National framework, and they've held lots of online consultations, and I attended one, and they had some great discussions there, so well done to everybody involved. So what does preceptorship involve, and just some of the key terms? So a preceptee is a new registrant. So for the purposes of this talk, that's a newly registered nurse or nursing associate. The preceptor is an experienced nurse who facilitates the preceptee's knowledge, skill, competence development and professional development and their confidence in practice. Preceptorship period is a structured period of preceptorship on registration where a newly registered nurse and nursing associate is supported by one registered nurse or nursing associate, and that includes protected time in their first year of registration. And I need to make clear that a nursing associate cannot, experienced registered nursing associate cannot act as a preceptor for a registered nurse. Your preceptor should be within the discipline in which you work. Preceptorship ensures that the new registrant receives clinical support and professional development. When we look at the role of a preceptor, preceptors should have some training, and the gold standard would include access to ongoing preceptorship support and development. And the National Preceptorship Framework for Nursing, NHS England, suggests that the preceptor should have a minimum of 12 months post-registration experience, be senior to the preceptee and from the same discipline. For example, a senior nursing associate can act as a preceptor for a newly registered nursing associate, but not a registered nurse, as I just mentioned before. And the gold standard would be that one preceptor should have no more than 2 preceptees. Length of programme and protected time. So again, there's differences across employers, hence national preceptorship frameworks are advising employers on good practices. So the National Preceptorship Framework for Nursing, NHS England 2022, advises the following: a minimum of 6 months for a core standard programme length, and 12 months as a gold standard. So you've got the minimum and then the gold standard. So a minimum of 2 weeks supernumerary period for the preceptee, the newly registered nurse or nursing associate, and that equates to 75 hours. That's within the first 2 weeks. So across employers, again, you may see differences in protected time. When you first start as a newly registered nurse or nursing associate, you should have a set supernumerary period where you're not in the rota numbers. And as the previous slide stated, it was 2 weeks ideally as a minimum. But a core standard of 8 hours protected time should be given to each preceptor per year to accommodate development meetings with the newly registered nurse or nursing associate. The gold standard would be 12 hours of protected time per year, and that should be included in organisations' preceptorship policy, and that is in the reference of the National Preceptorship Framework for Nursing. Preceptorship meetings, the first meeting between a preceptor and preceptee should take place within the first 2 weeks of joining an organisation, with a minimum of 2 further meetings with an interim meeting halfway through the preceptorship period. So sort of at the beginning, the middle, and then at the end of the preceptorship period, be it 6 months or a year. The gold standard, though, would be bi-monthly, twice-monthly meetings during preceptorship period. And these meetings, it's advised, should be about an hour long each. And that includes protected time for the preceptee and preceptor. So this is the gold standard here. And there are meeting templates in the National Preceptorship Framework and NHS employers also. I'll talk about some of the resources, but there are some meeting templates that preceptors and the preceptee can use to facilitate those meetings. So looking at the preceptorship programme, because areas and settings in nursing greatly vary, it's flexible, and facilitated learning varies according to the area and the setting. It should include study days for all preceptees. All preceptees should have some sort of preceptorship programme and some study days. There should be an initial discussion to explore development needs, to set aims, goals, objectives, ongoing development and review meetings. And then alongside that, there should be some clinical supervision. And clinical supervision, I have a video I've recently uploaded. Clinical supervision may link to professional supervision, so you've got a buddy and somebody to work with on a day-to-day basis, but also you have reflective meetings where you may have what's called restorative supervision, for example, where you have time to reflect with an experienced nurse. And then also some well-being support. So many preceptorship programs that I've reviewed and looked at have sort of action learning sets or group peer support clinical supervision alongside preceptorship programs. But there are a lot of different ways of delivering clinical supervision, which is why I did a video on that. I've also got a video on writing aims, objectives and SMART goals if your employer looks at you developing and writing your own SMART goals. So need for protected time in practice. So in 2014, this is an article that I wrote for the Nursing Standard, and I was asked to lead the creation of this preceptorship programme for newly registered nurses in a large NHS trust. And this was a collaborative project with the steering group, and it included managers and educational leads. And this curriculum aimed to deliver a 3-tiered approach to preceptorship. And I think in essence, that's what is very good for facilitating new starters, because if you can give them some study days where they have some skills training and some theory, go through some of the risk assessments. I'm in an acute trust, so we went through sort of risk assessments, and then we have discussion groups. And also alongside that, having the clinical professional supervision in practice where they have a preceptor, but they may also have clinical buddies, because you may not always work alongside your preceptor necessarily. And then also having action learning sets. That's what we set up initially. And newly registered nurses and managers evaluated the programme. So it's quite a helpful article for anybody looking to set up a programme to talk you through the stages of that. And the findings from the evaluation were very positive. The newly registered nurses felt increased confidence and competence. And one thing they asked for was more time with the preceptors in practice, and that's come out nationally in a lot of papers that it's fantastic to have programmes, but staffing rotas have to allow for that protected time in practice, and I really strongly would agree with that. So it's something that's being nationally discussed and debated, the need for looking at staffing ratios and protected time. And what was really interesting is Capital Nurse Preceptorship Framework. Capital Nurse have completed some fantastic preceptorship work. They developed a preceptorship framework across London, providing best standards of practice, again with some agreed protected time for preceptors. And within this framework, they suggest the guidance framework suggests the preceptee and the preceptor should work alongside each other at least 4 working days in a month. So you can see that preceptors may be not working alongside you, they can still be your preceptor, sort of similar to practice assessors really. We've got practice supervisors that look after students, but you have that practice assessor overseeing. It's sort of similar principle. If you can work alongside your preceptor all the time, that is amazing, but many can't. So I think this is really good, because this sort of is answering what came out of my paper, that the findings from my evaluation, that to have agreed time where a preceptor works alongside is helpful, because you need to keep in touch with that preceptee. And formal meetings with the preceptor at 3, 6, 9 and 12 months. So some key resources. Now, there may be changes, as there are in nursing very often, and things come around cyclically, but there may be key changes to the NHS England framework, but the resources are usually the same. You go onto the NHS Education Department websites, and you will find, because we have 4 nations, it's not just England, and you will find frameworks. The National Preceptorship Framework for Nursing, NHS England 2022, was recently published in October, and there was a set of standards and framework for good practice, but that can be adapted to different settings, and it's very well written. It's very practical, and it's not waffly at all. I find it very easy to read, and it's got some fantastic resources for employers to support implementation. It's also, what I really like is there's a table with National Preceptorship Model for Nursing from NHS England, and it has core, which would be like minimum standards, and then gold standards. So from my previous slides, I sort of talked about core and then gold standards, if you can achieve that. And then another key resource is NHS employers, and if you Google preceptorship for newly qualified staff, there are lots of resources and example programs. For example, the Capital Nurse Preceptorship Framework, the Sussex Training Hub website. And so you might be looking to develop your own programme and want to look at some resources, or you may be a newly registered nurse or nursing associate who is wanting to proactively look at some resources to help, and you can be proactive and bring some feedback forms, for example, to structure your preceptorship reviews. And then the Nursing and Midwifery Council have some principles for preceptorship, which are a series of principles that can be applied to preceptorship programmes. So looking at resources now and in the future, Google NHS education departments for their preceptorship frameworks, because things may change in the future. So currently 2022, NHS England have the National Preceptorship Framework for Nursing, which we've already talked about earlier. NHS Education for Scotland, they recommend that Flying Start is used as a national work-based learning programme that complements preceptorship. They recommend that the current timeframe for preceptorship is no less than 6 months and no more than 18 months. And preceptorship involves corporate local induction, the Flying Start NHS programme and professional development planning. So there is themes that are similar to, obviously, to the NHS England preceptorship framework. Northern Ireland Practice and Education Council for Nursing and Midwifery recently updated their preceptorship framework to align with reflective supervision, and again their preceptorship framework, they suggest that preceptorship should last a minimum of 6 months preceptorship period, and there should be a minimum of 2 learning opportunities a month during the preceptorship period. The Chief Nursing Officer for Wales is currently working in partnership on a vision for nationally consistent preceptorship for newly registered nurses, again linking to a framework of clinical supervision that continues throughout a nurse's career. Your supervision, your development and your learning shouldn't just stop at the end of the preceptorship period, because nurses should have lifelong learning. What would be wonderful to see, in my opinion, is the frameworks being joined, united together as one precept. I'd love to see one UK preceptorship framework. In my career, I'm coming to the end of my career, because often the departments work sort of have separate documentation, so I think that would be very helpful. Many newly registered nurses and nursing associates ask me, what do I need to know when I start my preceptorship period as a newly registered nurse or nursing associate? Any tips? So I'm going to give you a few. So the first thing to think about is, how is this organisation, this employer, going to support my preceptorship period? And this is something you should look at when you're choosing your first nursing role, as to what support they're going to provide. And I've got a video, choosing your first nurse post, if you are interested, to help you decide as well, because sometimes you might have a choice between 2 or 3 different areas. So do check out that video on my YouTube channel. So what will the employer provide to you? Do they have a structured programme? Do they have a preceptorship policy? How much supernumerary time and protected time during your preceptorship period will you receive? And I've already previously talked through what NHS England's preceptorship framework suggests as core minimum standards for supernumerary time and protected time. So keep up to date with local national preceptorship changes on national websites and social media. Who will support me? So you've looked at what support is supposed to be available to you, and who are the key people that will link to me during my preceptorship period. So first of all, your preceptor. Who is going to be your preceptor? And then, as I mentioned earlier, your preceptor may not be working with you on every shift. So you need to have a structure in place around that preceptorship period that includes your preceptor, but who's going to support you wherever you work in practice, whatever field. Identifying a clinical manager. Your line manager may be your preceptor, it may not. A clinical shift buddy. So on every shift you should have somebody you can ring or talk to, depending on your role. And clinical educators. Is there a structure for clinical education? It's very helpful to identify leadership, so your clinical leadership and management structures, and your education structures when you first start as a registered nurse or nursing associate. If your line manager goes off sick and your preceptor, who is the next person you go to for support, for example? So if on your supernumerary period, try and print off visuals, get names, contacts, and many employers have visual diagrams of those structures that you can download. You've also got medical, allied health profession, multi-professional teams, clinical governance, safeguarding teams, specialist nurses, clinical nurse specialists, advanced nurse practitioner, lecturer practitioner or consultant nurses. And there's lots of other roles out there, but there's just a few there of people that you can access, experienced people for support. So you also have national networks of support. So an example is the Royal College of Nursing Newly Registered Nurse Network, and you can link to them on Twitter, on Facebook, and they're a fantastic group of motivated nurses who do this in their own time. They manage the forums and the websites and Facebook and social media accounts, sorry, and you can ask them questions, you can share your experiences and feel that you're part of a community. The other thing to look out for is specialist support groups and forums in your field. So your employer may have some specialist groups that you can join. I recently was invited to talk at a national conference for the young and early career cancer nurses, and it was a fantastic group, really motivated, cancer care nurses volunteering to support early career cancer nurses, and it was a webinar and they had some amazing sessions. And in many specialist fields you will have similar sort of conference days and support networks, but it was really outstanding to see. And the Cavill Nurse Trust is a national UK charity that gives money and support to nurses, midwives and healthcare assistants who are facing personal or financial crisis. So you've also got sort of financial support that may need to be looked at. So these networks are good to know about. Also look out for additional available support, so peer support groups for newly registered nurses and nursing associates. Local or national groups might be available. Occupational health, so looking at your health and well-being support and advice. They may advise on skin care, for example. During COVID, many registered nurses, experienced nurses, also developed skin problems with the tight PPE that was being worn and facial masks. They will advise on reasonable adjustments and also help with referring for psychology or counselling services if needed. And then you've got human resources and freedom to speak up guardians, where you can talk to someone confidentially if you've got any concerns. And the employee assistance program is like a benefits system that employers sign up for. Again, you can access counselling, and you can if you've got personal problems, they will support you with certain problems and support. So thinking about self-management, just to let you also know, there's a Shiny Minds free app for all NHS nurses, midwives and healthcare support workers, and it's supported by the Florence Nightingale Foundation as well, and it's a free app and I've recently used it. And it's very helpful for reflection and for making you trying to promote a positive mindset and to pause and to reflect. And they send an inspiring quote every morning. So it's something, it might not be for everybody, but I have used it and found it helpful, and it's free, which is fantastic. And it's also for, as I said, yes, it is support workers, is written there. So using local and national resources, so find and review local preceptorship resources and guidance templates if you feel that you want. So your employer might not be using a template, and or there may be some templates out there and you'd prefer to use the template from the National Preceptorship Framework, for example. So have a look at those templates as well, be proactive and suggest guidance templates if there's none. So you can be that change in that area and suggest it. Or as a clinical educator, you might want to do that. So during your preceptorship period, you should access professional development support, and your preceptor should help structure that. You might have clinical educators and a line manager as well to help you. The sort of things you should be getting when you first start as a newly registered nurse or nursing associate: an induction. All employers should provide an induction. You may also have a specialist orientation program or study days that link to the area you're working, and there could be some in-house study days that you can access. There may be teaching packs, learning resources. Some areas have competencies and proficiencies for newly registered nurses or nursing associates, for example. You should have some supernumerary time, and as you saw earlier, I think the minimum was 2 weeks, and as a core standard, but you can ask for help. If your supernumerary time, you're really struggling, it may be that you might need your supernumerary time extended if needed, or you might need someone to work alongside you while during your third week or something when you come off your supernumerary. But do speak up if you're feeling very nervous and don't feel that you're coping or feel very overwhelmed. Just make sure you talk to somebody. Professional development reviews, and as you saw in previous slides, that might be 3 months, 6 months, 9 months and 12 months, or at the start, the middle and the end of your preceptorship period. And so finding out when you should be having those reviews. Now what you can do is be proactive and book them with your preceptor in advance. They can be very busy, and if you've got them as calendar invites and book them in, then they're there and they're ready to go, and if they get cancelled you can rebook them. And then appraisals. So and I'll be doing some videos in the future on professional development reviews and appraisals. So as you come to the end of your preceptorship period, you might be starting to think about future modules and academic courses. You may be really ambitious and know exactly which career pathway and be thinking about it right from the start. And I have 4 videos that are helpful. One on which post-registration nursing course, one on how to get funding for UK post-registration nursing courses. Funding is competitive, employers receive nurse education funding from government, and it's not a massive pot of funding, it has to be shared around. 5 tips for increasing your chances of funding, and some of you may have to have interviews for certain courses, or you may apply for scholarships, fellowships and for external funding. So that's a good video to help if you are having an interview as well. And they're all free on my YouTube channel. It's very important that you always prioritise your health and well-being as a nurse or nursing associate, because if you don't, you will burn out in your career. Always talk to somebody if you are struggling, and look out for other people. Access available support or help somebody else to access support if they're struggling. Escalate, and I talked about the structures, the management and educational structures, or you might want to go out to somebody else in a national forum. You might link to a lead and just talk to whoever you feel comfortable, but make sure you tell somebody if you're struggling. And do your research when you're choosing future roles, and employers won't retain you. You can move to other roles if they're not going to offer that support, so it's to their benefit to support you. So if you are interested, I have 2 books. If you look in the description, you can link to buy the books: How to Prepare for Interviews and Develop Your Career with lots of tips, and How to Thrive as a Newly Qualified Nurse. And I've also on my YouTube channel got lots of video aimed at early career nurses. So I hope you find them useful if you do access them. And some references there. If you don't feel comfortable asking me questions on the YouTube comments, which is quite public, you can DM me on my website, on Twitter or Instagram, and I'm very happy to answer questions there as well. So I hope you enjoyed the session.